Hello, my name's Kelly Buxey and I work for Medi UK. I'm one of the clinical trainers and part of my role as a nurse is to work alongside the NHS, and today I've been asked to share with you how the integration of the mTablet can be used within practice to screen for PAD. Using this traditional way that has been used in holistic lower limb assessment has provided good outcomes for those patients who have been identified at risk of PAD. So during this presentation, I want to share with you how nurses across the UK have traditionally used ABI and TBI as part of a holistic lower limb assessment guide, and how this traditional use of ABI and TBI can be used for PAD screening and early detection rather than just being used as a wound care assessment tool or guide. There's plenty of guidance and policies across the UK that is driving early detection of PAD forward and the need for this to be embedded within practice. I've got an example I want to show you of a lady that was highlighted as at risk and the journey that she followed within her own GP practice, and highlighting the benefits to not only that patient but the surgery or the GP practice theirself. So across the UK, holistic lower limb assessment is carried out for a number of reasons, but mainly because the patient presents with a wound to their lower limb. This is carried out by nurses as they are seen as the expert within this field. Holistic assessment is carried out undertaking the full medical history, signs and symptoms, and asking the patient what's been going on with them recently, why they've presented with the problem. And part of that assessment, which is a crucial part, is carrying out an ABI or TBI, as this will allow the nurse to assess the patient's vascular status and mainly excluding PAD. And with regards to wound care, ABI testing in the UK is considered as gold practice, as it will determine the treatment plan that will follow. As I've said, ABI and TBI is carried out as part of their holistic assessment and is mainly used around treating leg ulcers within the UK, or if a patient presents with a lower leg problem. Medi offer a three-step approach, and the first step is about assessing that patient's vascular status, undertaking an ABI to establish is that patient safe to go into a compression device to help treat that active leg ulcer. So we know that ABI testing can be used and is used within the UK as part of a lower limb assessment, confirming PAD or if a patient is at risk when relating to wound care. However, we need to now drive forward the screening process and early detection of PAD to avoid significant harm later on in life for patients, regardless whether they have a leg ulcer or lower limb problem. We need to be looking at those patients that are at risk due to their long-term conditions or medical history. So we know that those who are at risk can develop severe complications. So why is early detection so important? And the reason for this is because we know 70% of patients are unaware that they even have the disease and don't realise they've got it, usually until the symptoms become more severe or complications occur. So working within the NHS recently and trying to promote early screening and detection of PAD within an area of practice has been successful. And the reason for this is to try and provide better outcomes for patients and avoid those severe complications later on in life. So slowing up the progression of that disease. Obviously, we know that if this can happen, we can reduce the risk of cardiovascular morbidity and mortality, and reduce the risk of those patients potentially needing a lower limb amputation in worst case scenario. And the kind of conversations we need to have with our patients is about their lifestyle, nutritional intake, and discussing exercise programs. Those that are smoking are at high risk of developing PAD, and obviously those patients who are diabetic, they need to maintain their glycemic control better. Within the UK, there are many guidances available and policies in place that are supporting early screening and detection for PAD to reduce harm that can be seen from a patient that has not been highlighted or detected as being at risk. So I've been working with surgeries across the NHS to try and implement this programme and drive forward the use of technology such as the mTablet to undertake a very easy and simple ABI to establish whether a patient has PAD or if they are at risk of PAD by undertaking that full holistic assessment, looking at their medical history and discussing potential signs and symptoms with that patient. So here is the case study that I wanted to share with you to show how easy it is to integrate this new programme for early detection of PAD. Why was this lady highlighted and entered onto the programme? Well, one, it was due to her age, 55-year-old, but two, mainly because of her at-risk status of being a newly diagnosed type 2 diabetic. This lady was seen by the GP, who then reviewed her medication and then booked her in with the nurse to have a full lower limb holistic assessment. And part of that holistic assessment was undertaking her ABI using the MESI mTablet. Her results came back as 0.91 on her right and 0.92 on her left, and during the discussion with the nurse, the lady identified that on walking she had some mild discomfort, which meant that she had to stop several times walking. Therefore, she was experiencing intermittent claudication. So again, signs and symptoms of some mild PAD going on. Her assessment sat within the M records and the GP was able to access this at any time. But a care plan was immediately put in place to try and slow up the disease progression that this lady may experience if this programme was not initiated. And within the care plan, there was a discussion around her lifestyle, her nutritional intake and the exercise that could benefit her, including the review of her medication. This lady was also commenced on low-level compression to try and increase her vascular status, and it was decided this lady, due to her mild diagnosis, would be reviewed within the GP practice at 6 monthly intervals, depending on each outcome of the assessment. So the mTablet has been very easy to integrate into GP practice and certainly has been a huge benefit to this programme. It's enabled quick 1-minute ABIs to be undertaken. We don't need long appointment times because there is no need for resting, and the machine is portable, so the patient doesn't have to move from one room to the other. And we can quickly switch over from an ABI to a TBI if the ABI results is undetected or we feel we need to undertake a TBI. The great advantage is M records, so that patient's results will be stored within that M records, and if the GP or another healthcare professional wants to access that assessment, this can be quickly retrieved via the M records and can be used to be sent onwards if referrals are made to vascular surgeons or teams for a second opinion, or if there's a need for an assessment for surgical intervention. Integrating the mTablet enables us to be proactive in identifying those patients at PAD and being able to deliver an effective treatment pathway to avoid any substantial harm. So within the case study, this particular lady was classified having mild PAD. Again, as I said, she was identified due to her age and her newly diagnosis of diabetes. So the aim of our program is to slow up that progression. She'll be monitored and checked. She's fully aware of signs and symptoms. If she gets any worsening of lower leg problems or concerns, she will return and a review will be carried out. So the case study I shared with you has shown how easy the mTablet can be integrated within GP practice to carry out those holistic assessments for those patients that are identified as at risk of PAD. And just by undertaking that holistic assessment, making sure that lifestyle modification is discussed, and undertaking that ABI to establish the stage of the PAD, and then making sure a treatment or care plan is put in place with regular reviews to ensure that the disease progression is monitored and potentially slowed to avoid unnecessary harm. So in summary, there are many benefits for your patient having this service and the integration of the mTablet to be able to undertake early detection of PAD through holistic assessment and ABI with the mTablet. As you could see from the scenario, the pathways that could be put in place for the patient can avoid serious harm and consequences, but also reduce costs to the health service. Also, it identifies if there's a need for onwards referrals and input from specialist vascular teams. But ultimately, the programme will support and improve best outcomes for your patient and improve quality of life by reducing the risk factors of cardiovascular morbidity and mortality, and ultimately, in worst case scenario, reducing the risk for need for lower limb amputation because PAD has been undetected. Thank you very much for listening to this short presentation. If you have any questions, please do ask them.